Prolapse literally means to fall out of place, from the Latin prolabi meaning to fall out. In medicine, prolapse is a condition where organs, such as the uterus, fall down or slip out of place. It is used for organs protruding through the vagina or the rectum, or for the misalignment of the valves of the heart. A spinal disc herniation is also sometimes called disc prolapse. Relating to the uterus, prolapsed condition results in an inferior extension of the organ into the vagina, caused by weakened pelvic muscles. Humans heart valve prolapse. The main type of prolapse of heart valves in humans is mitral valve prolapse, MVP, which is a valvular heart disease characterized by the displacement of an abnormally thickened mitral valve leaflet into the left atrium during systole. Tricuspid valve prolapse can cause tricuspid regurgitation. Rectal prolapse. Rectal prolapse is a condition in which part of the wall or the entire wall of the rectum falls out of place. Rectal prolapse can be a medical emergency. In some cases, the rectum may protrude. Symptoms of a rectal prolapse may be leakage of stool, bleeding, anal pain, itching, irritation, tissue that protrudes from the rectum. A surgeon may operate through the abdomen to secure part of the large intestine or rectum to the inside the abdominal cavity, rectopexy. Sometimes the surgeon removes the affected part of the intestine. Surgery also can be done through the perineum, the area between the genitals and the anus, to remove the prolapsing tissue. Surgery is most often successful for people who still have some control over their bowel movements. If the anal sphincter is damaged, surgery may correct the prolapse but not be able to completely correct fecal incontinence, lack of control of bowel movements. Fecal incontinence can both potentially improve or worsen after prolapse surgery. If the lining has fallen out of the anus and is around 7 cm or less, it should eventually retract back inside naturally, though the retraction can take up to 96 hours, 4 days. Female genital prolapse. Further information: uterine prolapse, female genital prolapse, uterine prolapse, or pelvic organ prolapse, occurs when the female pelvic organs fall from their normal position, into or through the vagina. Occurring in women of all ages, it is more common as women age, particularly in those who have delivered large babies or had exceedingly long pushing phases of labor. Smoking, obesity, connective tissue disorders, upper respiratory disorders and repetitive strain injuries can all increase prolapse risk. Minor prolapse can be treated with exercises to strengthen the pelvic floor muscles. More serious prolapse, for example, complete procedentia, requires pessary use or reconstructive surgical treatment. Reconstructive pelvic prolapse surgery may be done without resorting to complete hysterectomy by hysteropexy, the resuspension of the prolapsed uterus. Traditional gynecologic practice favors removal of the uterus or ovaries, or both, at the time of prolapse surgery, and one estimate states that of the 600,000 hysterectomies performed in the United States every year, 13% are for prolapse. However, there is concern that many of these hysterectomies may be unnecessary and that hysteropexy would suffice as a treatment instead. Pelvic floor prolapse. The rectum or urinary bladder may prolapse as a result of changes in the integrity of connective tissue in the posterior or anterior vaginal walls, respectively, resulting in pelvic floor prolapse. Symptoms may include a feeling of pressure in the pelvis, or the visible protrusion of organs from the vagina. Prolapse is almost never painful, but the change in position of organs may cause urinary or bowel symptoms. Pessaries are a treatment option for pelvic organ prolapse.